Can you see the screen?
No, sir.
No, sir.
Can you see?
Yes, sir.
Yes, sir.
Okay, fine. So next topic, that is related to rational drug use or rational drug therapy or rational use of medicines. So what do you mean by rational? Anybody knows what is rational? Anybody knows the meaning of word rational? We have two words, rational and irrational. Many times we say that rational thinking, irrational thinking, like that. Can anybody just give the meaning of it?
Proper,
Proper, okay.
proper and ethical.
Proper and ethical, very good. Anybody else?
Legal,
Hello? Huh?
legal, legal.
Legal, okay, fine. Okay, any other thing? Any other? Okay, we can also say it is as a justifiable, isn't it? That which can be justifiable, which can be most appropriate, okay, which is based on certain facts, then we'll call it as a just rational, okay, and which do not follow this, we'll call it as a irrational. So very important thing is what do you mean by rational use of drugs? Now we have seen, you have completed almost your pharmacotherapeutics and you have found that we have got so many information about that. We have got the various diagnostic criteria, we have got on that basis of we have got disease criteria, mild, severe, moderate, like that. We have got treatment accordingly. If you remember heart failure, then we have got A, B, C, D or stage 1, 2, 3, 4, like that. So in all cases we have got variety of such situations, and accordingly you know the treatment which has been prescribed by the guidelines. And how the guidelines are based? Guidelines are based on the experience. So if we follow that, that means that it is a rational one. Why it is a rational? We'll see the definition or what it is there. So rational of use of drug that requires a patient receive medications appropriate to their clinical needs. Now you have to relate all these sentences what we have studied just before this. Example, I told you in therapeutics what we have studied, that various diagnostic criteria, accordingly categorization, classification of various treatments, okay, which are best for the mild one, which are best for moderate one, which are best for severe one, what are good for emergency one. You have seen all this, and you have seen these guidelines which are best for the pregnancy, which are best for the pediatrics or children, like that. All these guidelines we have seen for different diseases. So in that cases we have to match these words with all our knowledge, okay. So patient receive medication appropriate to their clinical needs is one. Second thing is in the doses that meet their own individual requirements for an adequate period of time and at the lowest cost to them and their community. This is what the definition of rational drug use. Now again you correlate with whatsoever we have studied while guidelines, you will find that patient receive medication appropriate to their clinical needs means those who are having severe disease condition, they will need the treatment which is best for the severe one. There is no use of giving treatment which is very good and very useful for the mild conditions. Okay, so patients are receiving medication appropriate for their clinical needs. So their clinical need is what? The patient is severe, so that means the patient should have the treatment which is matching, which is appropriate, which is the best suitable or justifiable for the severe condition. It should be in the doses that meet their own individual requirement. No less dose, because if the dose is less, then treatment will not be successful, it will be failure. If more dose, then there are chances of adverse effects. So doses should be again appropriate. Doses again are given by the guidelines. You know about it. You have seen various guidelines giving various drugs and doses. Okay. Then for the adequate period of time, we know various kind of medications. If it is a short term problem, then we advise for short term treatment. Okay. If it is a permanent or long term problem, maybe hypertension, diabetes, etc., then we can prescribe for a lifelong one. Okay, so that adequate period of time, and this is decided on the basis of follow-ups, that this follow-up will give the idea, and accordingly we can give for that. Okay, just a minute. माहिती नाही. So I hope now you got the idea, because you have got the experience, you have seen in the guidelines that doses that meets their own individual requirement, that means it should not be smaller dose or lesser dose than prescribed, it should not be more dose than prescribed. If it is more dose than prescribed, that makes many harms, cost increases, adverse effect increases, less dose means treatment failure is there. Adequate period of time and at the lowest cost to them, because we have got so many medications. So until and unless we find that the low cost treatment is not successful, then we can go towards the higher cost. Again, at lowest cost to them means already I told you when we have discussed about essential medicine list, that lowest cost doesn't mean that the most cheapest tablet or most cheapest medicine. It means that overall healthcare cost should be minimum. Okay, if the drug is there are two drugs, one is maybe 2 rupees tablet, one is 200 rupees tablet, but if the 200 rupees tablet is going to give the benefit of maybe 2000 rupees in term of hospital stay, then we'll say that 200 is economical or it is having lowest cost, because cost is not only the tablet cost is overall healthcare cost, including that all the details you will get in the 5th year, we call it as a pharmacoeconomics. In that you will get all these conditions. Okay, this is clear now what is called as a rational drug use. Okay, now let us see next thing. Why there is a problem, why the rational drug utilization is not possible. Okay, so there are various cases, various reasons for that. There is a drug explosion. Drug explosion means so many drugs are available, and okay, what are the factor? We'll go for what are the factor which have make rational drug use important, or that has made the more utilization of this rational drug utilization. So how we are going for that? That is drug exploration, means we have got so many drugs available, we can compare them and we can select the best possible for that. So then you have got chance to select the most rational, most suitable for that condition. Then we have got efforts to prevent the development of resistance, example in case of antibiotics. So accordingly we can decide, we can plan about, and we can say that the best medication, or if it is required, combination of medications, so that we can prevent the development of registration. Growing awareness is another reason that even layman, we have got so many websites where anybody can see that, and anybody can see that which drug is comparatively better. There can be, and they can ask doctor also. So therefore the rational drug utilization has got its own importance. Then there is increased cost of the treatment. Whenever the cost of the treatment is increasing, then people will try to find out the alternatives, and accordingly they will go for that. Then consumer protection acts are there. If consumer finds that that was very costly, deliberately the cost has increased, then the person can go in consumer protection act. I'll add few more in this, that is, if it is an condition like US or European countries where insurance companies are they have to bear the cost, because almost 100% health insurances are there. So health insurers, they do have their own experts on the panels, and they will study the overall expenses which are made on that particular illness of that patient, and the expert finds that the treatment was not proper, and that has led to problem to patients or increase in the cost. In all cases, whether the treatment was failure, in that condition also they will be liable for the court case. And if they are unnecessarily, unduly increasing the cost of treatment, still the insurance company can take legal action on them. And because of that, because of several factors, the rational drug utilization has become very, very important. Okay, now how we can do this? What are the factors which are affecting it? Which are the factors which are playing very, very important role into it? So in that, policies, we should make the policies. We should make a legal framework and regulatory framework wherein one can check, if we are planning, we are discussing, we are suggesting people that yes, they should go for this, then accordingly that policy should be made, that the rational drug utilization should be there, or rational therapy should be done. Then patient and community should be made aware about it, they should be guided, they should be trained for that. Then you should have very good drug supply system, so that timely drug is available in a very, very accurate. Nowadays in vaccine condition, you must be knowing that supply chain is very important, because the temperature maintenance and all is very, very important. The prescriber, dispenser and their workplaces, they should be made aware about it. Whosoever is prescriber, that means clinical practitioner, dispenser means pharmacist, and their workplaces, may it be hospital, may it be OPD, may it be pharmacy. So there, this kind of charts or information should be made, so that the rational drug can be there. Now what are the irrational uses can be there? That is, the problem appears, starts with the wrong diagnosis. Because of that, or either even the diagnosis correct, there can be mistake in the prescription, or prescription can be irrational. Now diagnosis, what is the problem with the diagnosis? As I told you, during diagnosis we identify whether it is mild, whether it is severe, whether it is moderate. So suppose we do not do it, or even one can miss the total correct diagnosis of it. So if the diagnosis is missed, then whole treatment line is missed, and that will become irrational. Okay. Then next is a prescription. Even diagnosis is correct, Definitely once diagnosis go wrong, then prescription is going to be wrong, and if prescription is going to be wrong, then dispensing can be going to wrong 100%. Okay, but there is every chance that diagnosis is correct but the prescription is wrong. That is, the diagnosis was clear that it was a mild case, but the prescription was given for moderate or severe one, and vice versa, or the diagnosis say it is a moderate or severe condition and the prescription is written with the drugs which are for mild conditions, or change in the doses, change in the regimen. So that is a mistake that is occurring in the prescription. Selection of the wrong drugs, okay, that is another story. Then next is a problem with the dispensing. The doctor has written something, the pharmacist is going or giving something, or maybe doctor has written 40 milligram tablet, dispensing, so diagnosis was correct, prescription was correct, but dispensing was wrong, because instead of 20 milligram 40 milligram was given, or instead of 40 milligram 20 milligram was given, or similar namesake drug was given which do not have any action. So these are all resulting into what? The treatment failure or the problems to the patients, because it is not following the guidelines. The guidelines what you are asking for, that it is not being maintained. May not be deliberately, but because of that error, because of that mistake, patient is going to be suffering. And to avoid that, there should be very good idea about it, and there should be very good correction measures should be taken for that. So why diagnosis can we go wrong? Why diagnosis is affected? We have seen three important pillars or three important conditions making it problematic. One is what? Inadequate examination of the patient. Patient आया बहुत जल्दी है डॉक्टर को, हाँ अच्छा क्या हुआ, बुखार आ रहा है, ऐसा हो रहा है, वहाँ दुख रहा है, ठीक है, ये लो पैरासीटामोल लो, ibuprofen लो, चले जा. So that means the examination is not proper. He has not checked why there is a pain, what is the reason behind pain, okay, whether it is because of certain internal infection or injury which is resulting into secondary symptoms. So that will be understood, and then once that clear diagnosis is made, then the doctor can prescribe the correct treatment for the cause of the disease or problem. Then another reason is incomplete communication between patient and doctor. Patient बोलता कुछ है, डॉक्टर सुनता कुछ है, डॉक्टर पूछता कुछ है, पेशेंट बोलता कुछ है, और दोनों का अगर कम्युनिकेशन ठीक नहीं रहा, और बहुत सारी बार you may be knowing there are so many jokes you will able to see on either WhatsApp or and various forums like Facebook etc. Because they will say doctor मुझे कैसा कैसा ही हो रहा है. So no doctor will be able to understand कैसा कैसा हो रहा है. Okay, I am feeling uncomfortable. That means until and unless the patient is able to tell the something correct about that, so that the doctor can correlate it with certain clinical condition. So this is because of the incomplete communication, or somewhere there is a lack of that the proper understanding between that. Third is lack of documented medical history. जो तुम लोग SOAP लेते हो, इसका कारण ये है. SOAP क्यों लेते हो तुम लोग? सब्जेक्टिव डेटा, ऑब्जेक्टिव डेटा तो तुमको मालूम पड़ता है कि डायबिटीज़ है और कम एज में तो क्या फैमिली हिस्ट्री है, हाइपरटेंशन है तो क्या फैमिली हिस्ट्री है, तो डॉक्टर को वो इजी पड़ जाता है. या अल्कोहल लेने वाला है तो लीवर का चांसेस हो सकता है. सो अनटिल एंड अनलेस यू हैव गॉट वेरी गुड डॉक्यूमेंटेड मेडिकल हिस्ट्री, you cannot correlate, you cannot move ahead. That means there is a improper SOAP. Basically why irrational treatment is going? Because SOAP is not correct. Subjective data, objective data is not properly collected, and therefore then lastly inadequate laboratory resources. That is again inadequate examination of the patient, because laboratory resource से भी आपको डेटा मिलने वाला था, एग्जामिनेशन होने वाली थी, वो you have not done it, and therefore there is a problem about it. So this is what inadequate laboratory reasons. As there is a small village and the patient should be diagnosed with, maybe उसको बुखार आ रहा है, तो टाइफाइड का है कि मलेरिया का है कि स्वाइन फ्लू का है कि फ्लू का है कि कोरोना का है, ये जब तक लेबोरेटरी टेस्ट से नहीं पता चलेगा because fever may be because of several reasons. So that is, until and unless these laboratory tests are done, one cannot diagnose it, and after diagnosis, then next job is to give the proper treatment for that particular cause. This is very, very important, and thus it will be making problem. Okay. Now what are the problem with the prescription? As I told you, under prescribed, right? That is, जो जरूरी है वो नहीं प्रिस्क्राइब किया, that is called as under prescribing. उसको on the basis of that condition, मैंने कहा कि माइल्ड की कंडीशन है तो माइल्ड का ही देना चाहिए था, या सॉरी सीवियर की कंडीशन है तो सीवियर देना चाहिए था. सीवियर की जगह अगर माइल्ड के लिए ट्रीटमेंट दे दी, डोज कम दे दिए या ड्रग कम दे दिए, दैट मीन्स इट इज़ अंडर प्रिस्क्राइबिंग. ओके, क्योंकि कंडीशन सीवियर है बट ट्रीटमेंट माइल्ड के लिए कर दी, या जितनी टैबलेट्स या जितने कॉम्बिनेशंस देने चाहिए थे वो नहीं दिए. So that means it is under prescribing. Under prescribing will result into what? Improper treatment. If it is improper treatment, means what? Patient will not be cured in the given period of time. Patient, and there is chance that the case may get worse. Okay, that is the problem with that. Another is incorrect prescribing. Incorrect prescribing means diagnosis ही गलत हो गया, या diagnosis सही भी हुआ तो भी डॉक्टर ने जो उसके लिए जो देनी चाहिए थी वो मेडिकेशन नहीं दी, and something different is given. So this is, we call it as a incorrect prescribing. Then one term is there that is called as extravagant prescribing. Extravagant means doctor thinks that this should be work, but the doctor does not have any data supporting it. अगर अभी मान लो रिसेंटली कोरोना की केसेस दिए होगी तो एक्स्ट्रावैगेंट प्रिस्क्राइबिंग किसको बोलेंगे? जब तक डेटा नहीं था अपने अपने मन से बोल रहे कि नहीं नहीं हाइड्रोक्सीक्लोरोक्विन बहुत काम करेगी, है ना, और फिर कुछ दिनों के बाद मालूम पड़ेगा कि वो कुछ भी काम की नहीं है. तो इतने पेशेंट जिनको वो भरोसे पे दिए थे, सो दिस पेशेंट्स आर हैविंग डिफिकल्टी. सो दिस इज व्हाट वी कॉल्ड एज ए एक्स्ट्रावैगेंट प्रिस्क्राइबिंग. व्हाट इज नोन एज ए ओवर प्रिस्क्राइबिंग, जितनी ज़रूरत नहीं है उससे ज़्यादा प्रिस्क्रिप्शन देना. अगर मान लो 3 गोली से काम चलने वाला है तो हमने 5 गोली दी, दैट इज़ ओवर प्रिस्क्राइबिंग. या माइल्ड के लिए जो ट्रीटमेंट है वो जो माइल्ड कंडीशन है और ट्रीटमेंट जो की है वो सीवियर के लिए जो देनी है वो अगर हमने ट्रीटमेंट की, दैट इज़ वेरी मोर पावरफुल ड्रग और मोर डोसेज, देन इट इज़ वी कॉल्ड एज ए ओवर प्रिस्क्राइबिंग. एंड मल्टीपल प्रिस्क्राइबिंग मीन्स डॉक्टर चेंज करते जाता है, नहीं नहीं ये नहीं ये लो, ये नहीं ये लो, उसको बंद कर दो इसको ले लो. सो दिस इज़ व्हाट इर्रेशनल, बिकॉज मेनी टाइम द पेशेंट मे नॉट एबल टू कंप्लीट द डोज ऑफ वन टाइप ऑफ टैबलेट. सो दिस इज़ मल्टीपल प्रिस्क्राइबिंग. या आज एक प्रिस्क्रिप्शन दे दिया, फिर शाम को दूसरा दिया, परसों तीसरा दिया, उसमें से कुछ पहली वाली निकाल के नहीं डाली, दूसरी निकाल के, इससे पेशेंट का भी कन्फ्यूज़न होगा एंड द पेशेंट मे नॉट रिसीव अ प्रॉपर ट्रीटमेंट. नाउ व्हाट आर द रीजंस बिहाइंड इट? We'll see reasons which we'll see later rather, and we'll see what pharmacist can do it. Because here pharmacist, it doesn't mean jo diploma pharmacist. Here pharmacist we mean that the person like you who are having PharmD and who have studied the medicines in very very details. For 6 years you have studied these medicines, and therefore you know very much important things. Before that, yes, last one is remaining, that we will complete first, and then we will go for what is the role of pharmacist. So first, last thing is, we have seen what problems are related to diagnosis. Second, we have seen problem related to prescription, and third, we have related to problem related to dispensing. I remember we were calling it as a problems of D. Okay, there are so many D's are involved in that. For any kind of disease, that is first D. There are so many D's are involved. First is a doctor, means doctor should be good one, it should be proper one. If doctor is not correct, he is having less knowledge, the patient will be suffering. Second is if you go to the proper doctor, that is correct, okay, or improper doctor, koi bhi hoga. Then second D is diagnosis, how the doctor is diagnosing it. We have seen the diagnosis. Next is drug, that is selection of drug. We have seen about prescription. Here अभी अपन ने prescription देखा, that is drug. which kind of drug doctor is preferring, whether it is correct or they are rational or irrational. Next D is whatsoever drugs are there, what are their dose. Okay, the dose is proper or not. 20 milligram, 40 milligram, 100 ml, 200 ml, 2 milligram, 4 milligram, whatsoever per day. So that is dose. Then next is a direction. The tablet which should be taken during evening should be taken during evening. Tablet should be taken along with food, should be taken along with food. The tablet should be taken at empty stomach, should be taken at empty stomach. This is called as a direction. Okay, you can write it down. Huh? This is not in anywhere. Simultaneously you can write it down. So how many D's we have seen? Doctor, diagnosis, drug, dose, direction. Okay, then duration, for how long you need to give that treatment. Okay, so these D's, all these D's, if they are appropriate, then the patient is going to be cured timely. If not, then patient is likely to suffer either for more time or even more than the disease because of the adverse reactions or any other thing. So these are very, very important thing. Yes, one more important thing in that is, after dose, direction, duration, next thing is a dispensing. So this is another D which is there, which we are going to discuss. Now everything was correct, डॉक्टर ने सब सही करके दिया, डायग्नोसिस सही है, ड्रग सही है, डोज सही है, डायरेक्शन भी सही है, ओके, ड्यूरेशन भी सही दिया है. फार्मासिस्ट के पास आता है वो गड़बड़ कर देता है. हाउ इट इज़ मेकिंग, दैट इज़ इनकरेक्ट इंटरप्रिटेशन ऑफ द प्रिस्क्रिप्शन. व्हाट्सएप पे बहुत सारे जोक पढ़े होंगे तुमने कि आता है डॉक्टर ये दवाई मैंने पूरे गांव में घूम के आया पर कहीं मिली नहीं, पर एक खाली दवाई वाला बोला कि अगर आप टाइम देते हो तो मैं कल मंगा के देखता हूँ. वो व्हाट्सएप पे देखा है कि नहीं किसी ने जो. तो दैट मीन्स व्हाट कि वो फिर वो डॉक्टर बोलता है अरे ये तो मैंने खाली पेन चलाने के लिए किया था. सो दैट मीन्स सच ए पुअर हैंड राइटिंग इज देयर. फार्मासिस्ट आर ट्राइंग टू समहाउ डिसिफर इट. उसको कोशिश करते हैं अंडरस्टैंड करने की, उसमें से जो पॉसिबल हुई वो मेडिकेशन दे देते हैं. तो डॉक्टर ने खाली जो लाइन चलाया उसमें भी एक फार्मासिस्ट इतना होशियार था कि बोलता है मैं कल तक मंगा के दे देता हूँ तुमको, है ना. सो दैट मीन्स दैट समथिंग रॉन्ग इज गोइंग ऑन. इनकरेक्ट इंटरप्रिटेशन ऑफ प्रिस्क्रिप्शन कैन बी देयर. अभी तो फॉर्चुनेटली या अभी तो बहुत सारी जगह ये ख़त्म हो गया, नहीं तो एक्चुअली डिस्पेंसिंग का मतलब होता था कि आप लोग वो पाउडर्स कलेक्ट करके यू मेक इट एज ए पाउडर और टैबलेट और समथिंग लाइक दैट. छोटी छोटी टैबलेट फार्मासिस्ट ही बनाते थे, टैबलेट ट्रिचुरेट जैसे बोलते थे उसको. सो दैट मीन्स दैट रिट्राइवल रॉन्ग इंग्रेडिएंट्स. तो उसके लिए जो चीज़ें चाहिए वो बराबर नहीं लेते थे या उसका कैलकुलेशन ठीक से नहीं करते थे. ओके, काउंटिंग ठीक से नहीं कर रहे थे, कंपाउंडिंग की जो प्रोसीजर है डिस्पेंसिंग की वो ठीक से नहीं करते थे, मिक्सिंग बराबर नहीं करते थे, या लेबलिंग अच्छे से नहीं करते थे. ड्रग ए की जगह ड्रग बी दे दिया, ड्रग बी की जगह ड्रग ए दे दिया, तो दैट वाज अ प्रॉब्लम. कंडीशन हाइजीनिक नहीं थी. मान लो डिस्पेंसिंग की जगह पे बनाया पर वो पुराना मोटर पेसल जो है वो उसी में नया बना के दे दिया आपने, उसको धोया नहीं था ठीक से, तो पुराने वाले की मेडिसिन इसको भी चली गई थोड़ी बहुत, जो हो सकता है इसके लिए हार्मफुल हो. पैकेजिंग इज़ नॉट, मेनी टाइम दे आर नॉट गोइंग गुड क्वालिटी पैकेजिंग. सो उससे ड्रग की जो सेल्फ लाइफ है वो कम हो जाएगी. पैकेज बराबर नहीं है, उसके लिए वो पेशेंट को हैंडलिंग में दिक्कत होगी, और हैंडलिंग दिक्कत होगी तो हो सकता है वो पेशेंट ट्रीटमेंट टाइम से नहीं लेगा. ओके, और पैकेजिंग ऐसा है कि उसको लेने की इच्छा नहीं होगी. सो दीज आर वेरियस कंडीशंस विच आर मेकिंग. नाउ व्हाई, व्हाट आर द प्रॉब्लम विच आर देयर when the irrational use of drug is there. So as I told you, अभी मैंने क्लास में बहुत सारी बार बोला कि it will cause ineffective and unsafe treatment. Treatment will not be safe because and ineffective. तो दोनों में, या दोनों में से एक होगा या दोनों होंगे. या तो इनफेक्टिव होगा तो भी पेशेंट को हार्म है, और बहुत इफेक्टिव है और सेफ कम है कंपैरेटिव टू रैशनल तो भी पेशेंट को हार्म है. और अगर इनफेक्टिव और अनसेफ दोनों है साथ में तो इट इज़ स्टिल मोर हार्म. देर इज़ एग्जासर्बेशन और प्रोलॉन्गेशन ऑफ इलनेस, यस, अगर इफेक्टिव नहीं है तो या प्रोलॉन्गेशन ऑफ इलनेस होगा, या अगर इलनेस इन्फेक्शन टाइप का है तो वो ग्रो हो जाएगा, ज़्यादा हो जाएगा तो बहुत ज़्यादा हो जाएगा, और अगर अनसेफ है तो भी द पर्सन विल हैव मोर हार्म. दिस विल कॉज डिस्ट्रेस एंड हार्म टू पेशेंट. पेशेंट ने एक्सपेक्ट किया था कि मैं जल्दी ठीक हो जाऊंगा तो मेरे काम पे लग जाऊंगा, मेरा पैसा कमाऊंगा, मेरे ये करूंगा वो करूंगा, ये नहीं होगा तो वो भी डिस्ट्रेस में आएगा, फैमिली वाले भी तकलीफ में हो जाएंगे. और अगर इलनेस बढ़ा तो इलनेस की भी कॉस्ट बढ़ती है, इलनेस सीवियर हुआ तो और कॉस्ट बढ़ती है. सो लाइक दैट अभी कोरोना में लोगों ने देखा होगा कि अगर टाइमली लोग जो नहीं गए, उनके जैसे ही सब काम बढ़ता गया, HRCT वगैरह वगैरह बढ़ते 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 एंड इट बिकम्स हॉस्पिटलाइजेशन. अगर हॉस्पिटलाइजेशन में वापस प्रॉब्लम आया, म्यूकरमाइकोसिस. सो दिस इज़ व्हाट हैपन्स इन एनी काइंड ऑफ ट्रीटमेंट, एंड एज ए फार्मासिस्ट वन शुड बी अवेयर अबाउट इट. तो इतना समझ में आ गया सबको? व्हाट इज़ रैशनल ड्रग,
Yes, sir.
what is rational drug, and okay, and what are the causes for rational drug, which are the factors which are contributing for the rational drugs or irrational, and we shall see next time what will be the role of pharmacist in this. ठीक है? So you go through this, it's very easy to understand, there is nothing difficult for that. You search it on that, and all this point whatsoever I had told today, you try to cover all these points. Okay, take care and be safe. Remaining thing we shall see in next class.